westernized form of medicine. Surrounding it would be the complementary medicine. If a doctor focuses only on allopathic medicine, the patient is going to be less compared to a person who receives both. As you can see, there are natural products to the right. There are mind and body therapies listed underneath it. And at the bottom level, I think these are what you do with Elken here in Malaysia, correct? Yes. So a round of applause for Guasa, please. Oh, these are some of the slides, just one slide where I learned some, or rather I conversed with some of the researchers and some scientists in other countries related to the use of MIME. And this is MIME. You know what it is? MIME is an immune support dietary supplement from the mycelia, that means the root of lentinula. It is designed to produce, to enhance our own immune system. And that is through the natural killer cells. Nothing can actually claim, not surgery, chemotherapy, or radiotherapy, say it's a guaranteed cure for cancer. Right now, the only thing that can cure cancer, like the lady who gave a testimonial, is our own body. Our body produces what is needed to fight off cancer cells, as long as we provide the precursor, the ingredient, so that it can produce the two kinds of cell, the T and the B cell. And the T and the B cells will produce our own natural killer cells. That is simply putting it for explanation of this slide. But there is an addition to what MIME can do. It can help produce dendritic cell. A dendritic cell makes it possible for the body to recognize a cancer while it is still beginning. You do not have the cancer cells, but it may be growing inside of you because you're exposed to someone who is smoking. Or maybe you are taking always the wrong kind of fast food. So what the cancer cell is there, while you are healthy, even MIME may be good for you. Do you follow? It's not only for cancer cells. It is always good for everyone. These are some of the studies done on MIME, as you can see. You can see the orange color of the bar graph. With the introduction of MIME, we realized that there is an increased production of natural killer cells against colon cancer. Another study will show, you can see this is the intestine, or we call the gut. Inside the intestines, what we call the Peyer's patches. Those small organelles, the Peyer's patches, produce the two kinds of cell, the T and the B cells. And that is why we take the MIME orally. Because once it enters our digestive system, it now goes into our intestine, and in the intestine, production of the natural killer cells is hastened. As you can see, and this is where many surgeons disagree with some practitioners, when a person is taking something to improve the immune system, like MIME, the survival after the operation is much better. There is less bleeding, there is less complication, the patient gets out of the ICU faster, and over the actual study of it. With MIME, as the orange line graph will show you, there is a better survival rate after surgery. So, as you can see, the Philippines, because of its law, the Republic Act 8423, we tend to convince many of our surgeons. As we understand, there are surgeons who would say, do not take MIME or other immune stimulating products before the surgery or after surgery or while undergoing chemotherapy because they may interact with our medication. But new science has shown, and we are glad that we have the law, that we can combine it with their treatment and they have nothing to worry. And what do we say to the patient if they are afraid to do so? I simply mention, MIME comes from mushroom, and mushroom is food. It just so happened it is a very nutritious food with a particular purpose to boost your immune system. Don't you want that while you're getting well? So people now will agree. However, the patient is still taking the chemotherapy. There is a synergistic effect. What do you see? There is less nausea. There is less vomiting. There is less pallor or becoming pale. The patient measurement for anemia is improved. Now, who wouldn't want that? That the response to chemotherapy is much better. Because many patients are not able to finish the 6 cycles of chemotherapy. After the second dose of chemotherapy, are ready to call it quits. Their skin is bad. It's so dry. Their hair is only a it is in their pillows already. And then they cannot eat. And they're miserable. Imagine if you find something to give to them like MIME, and they do not have those symptoms, then they will readily accept the fate of chemotherapy. This is a proof, the synergistic effect of MIME before and after. As you can see, there is less loss of hair on the mice. As you can see, there is increase, or rather there is decrease in the size of the tumor. Are you still okay? Do you find it too technical? Okay, thank you. Not too fast, isn't it? All right, good, thank you. Okay, so I think we are half of our slide, so I hope you will still be with me some more. This slide is only to show you that the side effects of multi-drug chemotherapy is reduced markedly with MIME. And now, these are interesting cases. If you'll permit me, for each case, maybe I'll give about a 30-second or 1-minute introduction of what happened to this case, why it came to me. And I only have 5. And of course, there are more. But I think for time restriction purposes, am I okay with time? All right. Then we can discuss 5. For purposes of privacy, Mr. Wong was very nice to have covered part of the face, which is the eye, and the full name of the person, and I hope the contact number, because maybe some of you will be texting this person. How are you already? But these people have agreed that I take their picture, not really for presentation here, but during the treatment, because I believe we will be making a big difference in their cases, and so they have agreed that we document their cases. Some pictures may cause some discomfort. Well, we are all adults here. Just cover your eyes if you think it's too weird. And this is a case of a male, 39-year-old, with throat cancer, stage 3. You can see the drawing that I made during our first consultation. When he came to me, there was a tube sticking out of his nose. 12 weeks with that tube sticking. Sport. So a lot of people are afraid, why is there a big tube sticking out of his nose? He has throat cancer. Throat pharyngeal cancer. When we go into it, we use a needle, take a sample, we call it fine needle biopsy. Some call it biopsy. We get a very small sample, we place it on a slide, we take a look at under the microscope after putting some dye, and then we are able to know what kind of cancer cells are inside. For this particular case, it is called adenoid carcinoma. It is a cancer that grows rapidly. So there is already growing through the nostrils. That's why when he speaks like this, "Doctor, check up ako." Because there's something growing inside. And he keeps swallowing because there's something that is blocking his throat. So can you see the discomfort in the gentleman? This is his picture. So there's a circle there. If it is enlarged properly, you can actually see the mass. We call it the fungating mass that is growing from here and then extending upwards and then extending downwards. That's why there is a tube coming out of his nose, is because he has undergone surgery. But he refused chemo and radiotherapy. The doctor initially removed that mass, but it grew back. So he doesn't want to do any more surgery. That's why he came to me. And these are his presenting problems. He has chronic sore throat. He has bouts of fever because of the infection. There's difficulty of swallowing. We call it dysphagia. Because you cannot swallow, you cannot eat. You cannot eat, you lose weight. Upon introduction of MIME, we documented his case for I think about more than 6 months. Okay? But in less than 6 months that we were doing it, the sore throat is resolved. The fever was gone. He was able to eat and to swallow, and there is weight gain. I think you should clap once you see the next picture. This is him afterwards. Do you see the smile? Although it's a small picture, do you see the smile when he was receiving the MIME? If you take a look at the throat, there is less inflammation inside. And if you take a look at the skin, he is less pale. And notice, he has hair. Successful case. Thanks to MIME. That is not only quality of life, that is actually improving his condition. Second case. There is a lady who traveled 8 hours by bus from the northern part of the Philippines to reach my clinic in the city, and she traveled in the evening taking a bus by about 9 or 10 p.m. so that she can reach my clinic at about 8 a.m. Unfortunately, although my clinic opens at 10, I do not come to work until 1. I have fatherly duties in the morning. So at 1 o'clock, I saw this lady. She is some sorts of a school principal. She was diagnosed to have one of the most deadly kind of cancer. It is cancer of the pancreas. Many of you know where the pancreas is. It is in the middle of the abdomen. Surrounding it is the small intestine called the duodenum. On top of it is the stomach. And on the right side of it is the liver. And underneath that is the gallbladder. When the pancreas is big, is huge, is inflamed, it blocks all of those things. It blocks the stomach, the duodenum or the intestine, the liver, and the gallbladder. So what will happen to the patient? She will be yellow. Jaundiced, we call it. She cannot eat. She will have pains. Of course, she will lose weight. And she will become not only yellow but pale. And if you notice, I made a drawing of the heart on my initial consultation because it has affected the beating of her heart as well. So she was devastated as a principal to be given this diagnosis. The funny story is, her assistant principal, when she filed for a leave of absence, removed all her belongings on the table, including the pictures of the family, and placed her own pictures there. Less than 6 months later, this principal came back to the office and declared that she's okay and ready to work. Can you imagine? Can you imagine the shock of the two people? First, the principal, all her personal belongings are gone on her table. And of course, the assistant principal, who was feeling to be promoted, has to go back to a lower, smaller table. This is her picture, or rather, this is her case. She has abdominal pain. I did a laboratory test called CRP to check if there is an inflammation ongoing. Of course, I knew that, but just for documentation, I saw that it was elevated. There is a mass that I can feel. She has a very big abdomen. She's yellow, and she cannot breathe properly. When we introduced MIME to her, reduced pain, the jaundice or the yellowing was gone. She was able to go back by traveling by herself, this time with no companion, after only several months of taking the 8-hour bus from her place to my clinic, see me for about an hour, and then go back to the 8-hour bus ride. And she has normal activities of daily living. That means she can do household chores and go back to work. This is her picture. Notice how big, this is her uniform that she is wearing. That's why she wears the same clothes. But you can see from the very big abdomen to the abdomen that is normal. Pancreatic cancer is one of the deadliest cancer, and normally patients with this are given 1 to 2 years to live. I saw her just last month, and we've been going steady for 5 years. I saw her last month so that I could sign a waiver that I am allowing her to travel by plane to Canada to visit her family. She brought me back chocolates. So the payment for doing this job is not only monetary. It's not only about chocolates. It's the smile. It's the satisfaction that you really did good. We share that to all of you. This is another case of a man. Cancer of the testis. One of the rare form of cancer. We do not know why people get this. Maybe it's the same way as cancer of the ovary. It's hormonal. That means it could be genetic. Now, a person with cancer of the testis will ultimately receive